I'll make you a bet. You know, Genghis Khan's cavalry were fierce warriors. They conquered more than 40 nations in total and carved out a vast territory. But what you almost certainly don't know is they may have been the earliest users of biological weapons. According to historical records, when they struggled to conquer a certain city after a long siege, the Mongols would use catapults to launch plague victims into the enemy's city. This caused the Black Death to rage through the city. When the enemy opened the gates to flee in a panic, they would also use arrows that had been soaked in horse manure and then fermented inside a stomach pouch, shooting them at the enemy. These arrows could have contained the world's most potent toxin, Tetanospasmin, an extremely potent toxin, lethal at a dose of just 2.5 nanograms per kilogram. You can go ahead and calculate for yourself how many nanograms it would take based on your own body weight. Typically, an amount the size of a single grain can kill hundreds of people. An infected person first experiences lockjaw as if their mouth has been sealed shut with cement. Then their facial muscles begin to spasm, contorting their face into a grotesque, bitter smile. Next, their body will arch backwards violently, their waist pushed up as if by a car jack, forming a bizarre arched bridge shape. Finally, the patient may turn blue from difficulty breathing and suffocate to death while fully conscious and in agonizing pain. Here's the bad news. Without any medical intervention, just like rabies, the mortality rate is nearly 100%. The even worse news is, even with aggressive and comprehensive treatment, the fatality rate for severe cases is still around 50%. Which all leads us to ask the question, if you cut your hand or scrape your skin, do you really need to get a tetanus shot? The legendary blade of tetanus all covered in rust. Is that rust really the source of all the trouble? If you get tetanus, how long does it take for symptoms to appear? And how can we prevent, treat, and deal with it? To get to the bottom of all this, we're first gonna humbly ask you for a like. Researching all this isn't easy, and the editing and reviewing takes a ton of effort. Your support is what gives us the biggest motivation to keep going. All right, without further ado, let's dive into the truth about tetanus. As the old saying goes, no matter how tough you are, you still have to watch out for a kitchen knife. What kind of knife is that? A butcher's knife. But what's even scarier than a kitchen knife is a rusty kitchen knife, which has earned the infamous nickname the Blade of Tetanus. Its motto is, one cut gives you tetanus, the second sends you to meet your ancestors. So is rust really the be-all and end-all for getting a tetanus infection? Actually, the answer is hidden in plain sight. The name itself gives us clues about a wound and a wind. The wound part refers to a physical injury, like a puncture, a cut, or a deep wound. But the wind doesn't mean a natural breeze, pillow talk, or some new fashion trend. It refers to what ancient people called an evil wind, which is basically their term for a pathogen. The pathogen that causes tetanus is called Clostridium tetani. It's found widely in soil and in the feces of humans and animals. So even if you have a brand new, sparkling, clean knife, if you stir it around in some dirt or manure, it can also become a blade of tetanus. This is also why battlefields where injuries are common and there's dirt everywhere are major hotspots for tetanus. So this Clostridium tetani bacteria, why is it so deadly? And why does it make people contort into such bizarre positions? Well, that's mainly because it produces a toxin that affects the human neuromuscular system, Tetanospasmin. This toxin blocks the release of inhibitory neurotransmitters like gamma-aminobutyric acid. This prevents muscles from relaxing, keeping them constantly tense and contracted, which triggers intense periodic spasms. In plain English, it's a cramp. A longer, more painful, and more violent cramp. And unlike the local cramps you get in your leg, tetanus most of the time can make you cramp from head to toe. First, the chewing muscles spasm, making it hard to open your mouth, causing lockjaw. Then the facial muscles spasm, creating a distinctive sardonic smile. Finally, as the powerful back muscles contract, the lower back arches forward and the head and feet bend backward, forming an arch, a condition known as opisthotonus. These spasms can be triggered by minor stimuli, like light sound or touch. Without treatment, patients often die from suffocation caused by spasms of the throat muscles, or from respiratory failure caused by spasms of the breathing muscles. The mortality rate is nearly 100%. So the question is, what kinds of wounds are more likely to get infected with tetanus? First, dirty wounds. That's because the tetanus bacterium, Clostridium tetani, lives in soil and feces. So if you get injured outdoors, or if a wound comes into contact with these contaminants, the risk of infection increases. The other factor is depth. The tetanus bacterium is anaerobic, which means it needs a low oxygen environment to reproduce. In a narrow, deep wound, it's hard for air to get in, and the dead tissue has no blood supply, making it easy for a low oxygen environment to form. So we need to be especially careful with puncture wounds from things like nails and needles, animal bites, especially from animals that like to eat poop, injuries from fireworks, as well as burns. All of these require special attention. Now, some of you might be confused, since burns aren't narrow, deep wounds. So why do you still need to be careful? This is because with a burn, it might look like the injury is just on the surface, but in reality, the deep tissue beneath the skin is already dead. That means there's no blood supply, which creates a dangerous oxygen-deprived environment. So that brings us to another question. How do you deal with a tetanus infection? In 1889, a bacteriologist and assistant to Robert Koch named Kitasato Shibasaburo used the anaerobic and heat-resistant properties of the tetanus bacillus to isolate it for the very first time. The following year, Kitasato teamed up with another one of Koch's students, Emil von Behring. Let's call them the KB duo for short. They took tetanus bacilli that had been treated with disinfectant and injected a tiny amount into some guinea pigs. Then they gradually increased the dose until the little guys could be injected with a huge amount and still be perfectly fine. Only then did Kitasato and Behring decide to stop. But stopping wasn't the end of the line. They then collected blood from these immune guinea pigs, and after extracting the serum, they injected it into guinea pigs that had never been exposed to the toxin. Next, they gave these new guinea pigs a lethal dose of the tetanus toxin. In the end, the guinea pigs survived. An excited Kitasato named these substances antitoxins. On December 4, 1890, the two jointly published a paper titled On Immunity to Diphtheria and Tetanus in Animals. This laid the foundation for serum therapy and blazed a brand new trail in the field of medical science. We now know that the reason this serum can fight off a specific toxin is because it contains antibodies, which are produced after small repeated injections of the toxin into an animal. This is what we call an antibody. It can be injected into a patient to give them passive immunity, becoming a powerful weapon in the fight against diseases like tetanus, diphtheria snake venom, and rabies. Model. So they found a method, but whose blood would they use? Guinea pigs and rabbits were definitely out. They were too small. That's when horses, being large and also highly susceptible to tetanus, became the perfect choice. This is why when you get a tetanus immunoglobulin shot, you have two options, one from horses and one from humans. The main difference between the two is that the equine version is from a different species, so it has a higher rate of allergic reactions, which is why you need a skin test before getting the shot. The human version is safer and doesn't require a skin test. Of course, it's also more expensive, usually several hundred yuan per shot. The equine version only costs a few dozen yuan. But it's important to note that regardless of which one you get, they can only neutralize the toxins that haven't already bonded with your neurons. So the sooner you get the shot, the more effective it is, and the less damage is done to your body. The incubation period for tetanus is generally 3 to 21 days. The length of this period depends on how far the wound is from your central nervous system. The closer it is to our central nervous system, the faster the toxins will reach the neurons, making the incubation period shorter and the situation more dangerous. That's why it's best to get the injection within 24 hours. Besides that, cleaning the wound is also crucial, because the immune serum can only neutralize the tetanus toxins, but the tetanus bacteria are still hanging out in the wound. The good news is, because the tetanus bacteria are strictly anaerobic, meaning they hate oxygen, they can't spread to other tissues or organs in the body. They can only survive in the oxygen-free environment of the wound. That's why the doctor will thoroughly remove any foreign objects and dead tissue from the wound, and rinse it repeatedly. If necessary, the doctor will also give you anti-infective drugs like metronidazole. However, for the tetanus toxin that is already bonded with the nervous system, there's no good way to get rid of it. You just have to tough it out with your own body and immune system. This process usually takes a few weeks to several months. Doctors will provide supportive care based on the patient's condition, including sedatives, muscle relaxants, and respiratory management. In some cases, they might even have to perform a tracheotomy. Only by getting through this period can the neurons start to recover their function, and only then can this patient begin to heal. We provide symptomatic treatment. For example, we place the patient in a dark, quiet environment to avoid triggering spasms. We might use sedatives and muscle relaxants to ease muscle rigidity and paroxysmal spasms, or use mechanical ventilation to deal with breathing difficulties. Through the continuous improvement of active and comprehensive treatment, the mortality rate for tetanus patients has dropped from nearly 100% to around 10% today. However, these reactive defenses are ultimately too passive. Once the toxin damages the nerves, the damaged neurons recover very slowly, which can take weeks or even months. Moreover, for elderly patients and patients with severe tetanus, the mortality rate remains high. So are there any more proactive measures we can take? Before the 1950s, tetanus was one of the leading causes of death for newborns in our country. This was related to the use of unsterilized instruments to cut the umbilical cord during birth, or unclean wrappings coming into contact with the umbilical cord. That's why neonatal tetanus was also known as umbilical wind. After the 1950s, the new Chinese government trained nearly 800,000 traditional midwives in prenatal and delivery care. New delivery methods that emphasize sterilization gradually became widespread. The incidence of neonatal tetanus and postpartum fever was drastically reduced. By 1978, the DTP vaccine was included in the National Immunization Program, becoming a key part of basic childhood immunization. DTP is an abbreviation for three diseases: diphtheria, pertussis, or whooping cough, and tetanus. If infants and young children are infected with any of the three, there is a high mortality rate. But after the DTP vaccination series is completed, it can provide long-term protection against all three diseases. November 1, 2012. The World Health Organization has announced that China has eliminated maternal and neonatal tetanus. So that begs the question, if we've all been vaccinated, why do we still have to worry about tetanus? The reason is simple: because antibodies, just like love, have an expiration date. After the 3-dose vaccination series, tetanus antibodies can last in the human body for 5 to 10 years. For some high-risk groups like soldiers, police officers, construction workers, outdoor field personnel, and serious outdoor enthusiasts, it's recommended to get another shot every 5 to 10 years as a booster. Through tetanus vaccination, high-risk groups can avoid needing an injection almost every time they get injured of a passive immunizing agent. This not only saves on medical costs, but also more effectively prevents the onset of tetanus. Lastly, in China, post-injury tetanus cases are mostly scattered throughout townships and rural areas. Farmers, workers, and students account for over 80%. This is closely linked to a lack of awareness about the disease. So let me stress this again. If you have high-risk factors or are simply unsure, please be sure to see a doctor right away. Do not take any chances. And for those of you who stepped on a nail a few years ago and are still worried about it, you can finally stop worrying, because the incubation period has long since passed. We hope this video can help everyone understand more about tetanus so that you're neither panicked nor complacent. All right, that's all for this episode. If you found this interesting, or if it was helpful to you, you can follow us. That way you can learn even more medical knowledge.